Singenile shiqi enyangeni lapho kubanda khona. Njengoba sazi ukuthi abantu mabelala balala namabhodlela anamanzi ashisayo, abanye bakhanyisa amahitha, abanye bakhanyisa imbawula baze balale nazo endlini. Kanti lokhu kugcina sekushile kushe indlu, kanti futhi beshile nabo emzimbeni. Kanti ke ku Dr Pru namhlanje sidecide ukuthi ake sibe nehambeli zethu esizosichazela kabanzi ukuthi ngabe ukusha ngaphandle kwalokho mina sengikhulume ngakho kungabe kubangwa yini, kanti kubakushita kanjani noma kufanele wenze njani uma ushile. Njengenjwayelo ke angihambi ngedwa, ngihamba nabo bodokotela. Singaqala ngayo uDr Pam akasichazele ukuthi uDr Pam uqhamukaphi, usebenzaphi nokuthi uvela kuphi kahle hle.
Ngibingelele kini nonke sinabo njengamanje kule platform nabo bonke ababukele. uDr Pam, uPamela Bongeka Mathebula, intombazane ebuya eThekwini lokishini elincane kuthiwa kwaNdengezi, eyenza ifundo zayo eziphansi zezokudokotela e-UKZN, then ngaspecialize in general surgery e-University of Pretoria. Njengoba ngishilo ngi-general surgeon, kodwa nginothando oluthe ukuba ngaphezudlwana uma kuza kuma-burns or kuza action. Njengamanje ngizinze kakhulu in private la ngisebenza khona Acacia Hospital, which is a neck care, naseButilong, which is a clinics group. Kodwa ngiyasebenza naseKalafong Hospital la kuyikhona ngisebenza khona kakhulu specifically ngama-burns.
Sibonga kakhulu Dr Pam ukufika kuma studio ethu. Kanti ngifuna ukwazi nje njengodokotela umfazi othanda ama-burns, ngoba vele ngithe mangifuna udokotela bathi uyi-one dokotela othanda ama-burns, and ngiyaqala ukubona udokotela special womuntu wesimami. Uthi yini ekwenza ukuthi uthanda ama-burns kangaka?
Ngiyacabanga ukuthi into engidonsele kuma-burns ukuthi abantu abaningi angazi ngithi bayawasaba noma abawathandi. Vele ke njengomuntu onjalo ngiyayithanda ukuhluka ebantwini abaningi. So yona into yokuqala engidonsele kakhulu la kuma-burns number 1. Okwesibili ke kodwa ukuthi nginale nkolelo ekutheni uma kuukuthi yonke into siyenze kahle kusukela ekuqaleni isiphetho siba sihle. Uma yenene impilo iba mnandi.
Sibonge Dr Pam. Sister Mirriam, ungake uchazele umbukelo osekhaya ukuthi ubani uSister Mirriam kanti usebenzela kuphi sisi?
Ngibingelele ke balaleli ezempilo. Lokhuluma ngoke nguSister Mirriam Zahoor, ngokuqala emndenini wakaLubisi le endaweni yaseNkomazi eShuzindala. Ngitheke nangitelwe endaweni yaseNkomazi eShuzindala ngase ngimuvela nganeno eWhite River like 18 years ago. Ngase ngitraina in-nursing. Nangitraina in-nursing ngayosebenza e-Mediclinic as a scrub sister e-theatre. Ngisebende kakhulu as a scrub sister e-Mediclinic theatre kwasi 2016. Ngahamba ngayosebenza eBusamed solo as a scrub sister. Then 2018 nga decide khona ukuvula i-practice yami. So nangivula i-practice yami bengivulela because I did an degree on occupational health. So bengivula i-practice because I want to do ama-medicals and as a primary health care. So kwathi bodokotela lebengisebenza nabo ke la kuma-private hospital bathi Sister Boni, bangibita nga-Sister Boni ke. Sicela ukuthi usendele ema-wounds because you know the sterility ezusebenze kakhulu e-theatre. Sitathanda ukuthi usendele ama-wound ethu. Base ke bangirefera to one company lekuthiwa uSmith and Nephew. uSmith and Nephew wase ke uyangitrainer as an advanced wound sister. So as an advanced wound sister, so I'm dealing with all types of wounds. So kwamanje ke ngisebenzela eMsholozi kul one village next to White River. Ngola ipractice yami khona ngenza kona ama-wound, all types of wounds, ama-burns, ngenza primary health care, occupational health, and I'm doing many more.
Asibonge Sister Mirriam.
It's okay.
Sinodokotela futhi ngaphakathi kwama-studio ethu uDr Nombulelo Metuse. Dr Nombulelo, umbukelo sekhaya ungathi uwe ubani kanti usebenzela kuphi, uqhamuka kuphi sisi?
Okay, ngiyazibusela kubo bonke ababukela abasekhaya nakubo bonke abantu abalathi la e-studio. Mina igama lami nguNombulelo Metuse. Ngisuka e-Eastern Cape, ngifunde khona amabanga amaphansi and then mase ngifunda ngudokotela ngafunda eMedunsa. Mase ngiceda lapho nga-specialize as a plastic and a reconstructive surgeon e-University of Pretoria. So khona manje ngibased khona lana ePretoria e-1 military hospital ngiyisoldier. And then a private ngiya Mulmet Mediclinic, Medfora Mediclinic nase Buthilu, and then nase Steve because ngisaya khona ngiyenza abantwana especially ababe benzi craniofacial ama clefts. I'm passionate ngakho. So yeah, that is me.
Sibonge kakhulu Dr Metuse.
Okay.
Miss T, wona waziwa ngo-Miss T. Namhlanje ke ngicela ukuchazela ababukeli ukuthi ubani uMiss T, kanti usuka kuphi, utholakala kuphi futhi?
Ngibingelela nonke enikhona kule program, ngibingelela nababukeli. Njengaziwa ngo-Miss T, my nickname from school, uThembi Maphanga, dabuka eWitbank, kodwa okwamanje ngihlala eMiddleburg as I'm working in Middleburg in one of the mines in the engineering field. And ngikhulele eWitbank, ngize ngapha ngizofunda ama-learnerships, ngase ngithola umsebenzi eMiddleburg.
Okay, sibonge Mrs T. Dr Mathebula, ngicela ukusichazele kabanzi nje ukuthi ngabe ama-burns ukusha kubangwa yini kahle hle?
Bonke Dr Pru, ama-burns ziningi izinto ezenzayo, kodwa esizijwayele kuyaye kube izinto ezifana namanzi, amanzi ashisayo, noma njengoba kusuke washo imbawula iyaye cause ama-burns, kodwa lawo ma-burns wona kuba awumlilo ngoba kusuke kusha izinto ezingaphakathi endlini la umuntu esuke khona. Bese kuba khona izinto ezingajwayelekile kodwa nazo ezishisayo njengogesi, bese kuba futhi nama-chemicals. Ama-chemicals kungasuka from into efana ne-hair relaxer, into esingeke size siyinake, kodwa iyashisa and ishisa to an extent yokuthi iyakwazi ukuthi ishiye iska. And then bese kuba khona ke amanye ama-chemicals ke lawo esiwathole enkampanini okumbe embonini ezinkulu esiyibiza ama-large chemical plants. Bese enye into eyayikhoza ama-burns esingayinaki ilanga, sunburn into eserious. Abantu abaningi abayinaki uyaye uzwa abanye behlekisa ngokuthi black don't crack ngoba uthi umuntu ngoba vele ngimnyama I mean ngizosha kanjani. Kodwa uthuke ukushona kwelanga mawuthi uyazizwa isikhumba sakho sibhlungu mawuthi uyathinta noma uthi uyazigcoba noma mawuthi uyageza ngoba nina ngokuhlale kakhulu elangeni. Kodwa ke i-sunburn ayihluphi kakhulu ngoba yona ishisa nje kancane, which is what we call a first degree burn. So ingakho abantu abaningi bangayinaki, kodwa inkinga ngayo ukuthi ngokuhamba kwesikhathi then ke ingasikhozela umdlavuza wesikhumba or njengoba baye beshoka belungu bathi skin cancer. So izinto ezifana nalezo ke nje eziyaye zikhoze ama-burns. Kodwa uma uthatha ubuyela kuloko ekushilo mangithi njengamanzi, akusiwona amanzi kuphela, abanye bayabashisa amatiye. Umunye akutshela ukuthi benkade ngithi ngipheke umdoko ekseni wachitheka wawibhode lawela onyaweni o lawela emzimbeni into ekanjalo. So noma ngabe yini engakwazi ukuthi ibile ingakhozela ezwela ukuthi ushe ube nama-burns.
Sibonge lapho dokotela. Mrs T, ungabe usichazele nje kabanzi ke ukuthi wena ukuze utholakala ushile ukwenza kanjani ukuthi ushe or washiswa yini sis?
Okay, ukuqhubeka ngokuzi-introduce uThembi Maphanga with gender-based violence and burn survivor and an activist today. Deciding ukuthi ngibe yi-activist, it's due to through izinto engikushaya kizo empilweni. In 2010, ngaba ne-argument with my partner, ubaba wabantwana, wase udecide ukuthi asivalele kamareni asishise. So usivalele lapho wakhanyisa imetris wasishiya lapho wahamba in a locked room. Luckily enough, I managed to phuma ngefestere lelo aphume ngalo nami in flames and everything. And back then I used to wear wigs and all that. So umlilo ubugijima nje in seconds emzimbeni wami. So ngazithola ngiyozicima ngilwa ngepompi amanzi, of which I had few seconds to decide because I didn't even know what to yenza lento. So saving us, me and my daughter, it was a thing yokuthi I have few seconds ukuthi ngenzeni. Khonile ukuphumela ngaphandle ngazithela ngamanzi, of which I know it wasn't the right thing now that I know better. Base abomakhelwane bayabona ukuthi indlu yasha, beza bazorescue umntwanami lo beka 2 years old. And then from there sasesiniswa ey'bhedlela ezihlukene.
Okay. Sibonga kakhulu Mrs. T, indaba yakho ibuhlungu kakhulu. And ngiyajabula ukuthi ngalokho okwenzekele kuwe, now you are an activist ku gender based violence. Sithemba ukuthi nabantu abazobelalele namhlanje bazoshintsha especially kubobabe when it comes to lento ye gender based violence. Dokotela Pam, akuqhubeke lapho. Nangu useyibekile indaba Mrs. T washa ngomlilo osho ukuthi yena. So ushilo ukuthi ama-shpens ayahlukahlukana uthe ubale ku first degree, ake singeneke manje impawini zakho ukuthi ngabe ukubonakala kanjani lokusha ukuhlukana njengoba nikuhlukanisa ngama-degrees ningibodokotela.
Okay. Ama-bands okwahlukanisa ngama-degrees akusikona ukuthi siwahlukanisa ngama-degrees ngokuthi adalwe yini, kodwa siwahlukanisa ngama-degrees ngokuthi ihambe kangakanani esikhumbeni, ngoba ukusha akusiyona lento esiyibona ngaphandle kuphela. Ukusha isikhumba, and isikhumba uma kuthi abanye bethu bayazi ngoba ngithi senze i-anatomy ne-physiology or histology la bechazela khona ukuthi isikhumba akusisona nje isikhumba, sinama-layer. So ama-degrees ke lawo adependa ngama-layer or ngama-levels esikhumba ukuthi ke ifike kuphi, la bese ke we must decide ke ukuthi umuntu uno first, second, third or fourth degree burn. Bese enye into ke before ngigxile kakhulu kuloko ukuthi ama-levels lawa or ama-degrees ama-burns ahlukana ke ngokuthi ushiswe yini. So uma sibuyela ke ekutheni uma une-sunburn for instance, i-sunburn liyaye likhoze i-first degree burn. Okusho ukuthini lapho? Okusho ukuthi usha nje isikhumba ngaphezulu kuphela, lokhu okubonayo nalokhu okuzwayo. So akujwayelekile ukuthi uma ushiswe yilanga kudlule any deeper than that. So it's what we call an epidermal burn or a superficial burn, first degree. Bese kuba khona u-second degree. Second degree usuke sewudlulela ke kwi-layer yesibili yesikhumba, la isuke isifuna udlulela nala kuba khona nefutha kancane. So lapho isuke seyiqala ke seyithi ukuba deepanyana ile. Kodwa nakhona u-second degree bese ke uphinde uhlukaniswa ke kabili u-A no B ukuthi ke ikude kangakanani or iseduze kangakanani nefutha. Ukuze ukwazi ukubona ukuthi umuntu ono-second degree na kuyaye sesithi buka isikhumba la eshe khona ukuthi kunjani. Uma kuwukuthi isikhumba la kuyaye kumile khona iy'nwele, bese uyabuka ubone ukuthi usayibona yini i-root yonwele. Uma usayibona i-root yonwele, then uyazi ukuthi okay, lo muntu kusho ukuthi uno-second degree and naleyo degree i-degree esangamanejeka ngaphandle kwezinto ezi-complicated. Bese kuba khona ku-third degree. U-third degree uyadlula ke udlulele efutheni. Mase udlule efutheni kusuke sekuyiloko esikubiza nge-deep burn. Okusho ukuthi ke lo muntu noma ngabe uzama kangakanani angeke kuze kube umuntu ozokwazi nje ukuthi umtreat-e ngokumdressa noma ngokumklina kuphela. Sekuyizinto ezodinga ukuthi umuntu ayiswe ke-theatre ayoklinwa, asikwe kususwe lezo zinto lezo isikhumba leso esishile kumbe esifile. Then u-fourth degree ke all the way isikhumba sonke sishile waze wayodlulela kuyimasela or kwesinye isikhathi nasethanjeni, ekutheni ke umuntu ke ushe isikhathi eside kangakanani nokuthi leyo nto imshisayo beyishisa kakhulu kangakanani. Bese ke kuba khona Enye-ke ibheni singayinaki or abantu abangacabanga ukuthi ibheni isiyibiza ngokuthi i-inhalation ban. Njengoba uMiss T eshilo wathi yena bamvalela ekamereni balayitha umetshisi bamshiya kanjalo. Njengoba wayeserumini leyo, angithi bekusha yena nomntwana kodwa futhi kusha nempahla lezo elapha endlini. Uma kusha uyayubona ukuthi kube khona umlilo or kube khona intuthu, sorry. Intuthu leyo uyayihogela njengoba usuku ukhala or uhayiza kuukuthi mhlawumbe ufuna usizo or ukhala ngoba uzwa inhlungu, uyayihogela leyo ntuthu. And leyo ntuthu uma uyihogela ishisa imigudu yokuphefumula kumbe ishisa umphimbo wakho wokuphefumula. Bese nakhona ekutheni uhlale isikhathi esingakanani kuleyo ndawo enentuthu, iyaye ikwazi nokuthi izidlulele ize ifike ngisho nasemaphashini. So lokho ke bese sikubiza nge-inhalational ban. Leyo ibheni serious ukudlula wonke ngoba ibheni enganakekile ngoba awuboni, angithi awuboni lutho ngaphandle ukuthi umuntu ushile. Wena uzoze uyibone ngokuthi umuntu mayithi uyakhwehlela noma uthi uyambuka kumnyama emakhaleni o emlonyeni o mayikhwehlela ukuphuma isikhwehlela esimnyama.
Oh, okay. Siyakuzwa Mrs. Dokotela. Manje ngifuna ukwazi la njengoba uthe le inhalation bans ibaluleke kakhulu. Siyabona khona manje ugesi uyadura, abantu benza izinyokanyoka, bese kuba khona electric shock. Ngabe ibungozi kangakanani electric shock?
Dr Pru, ama-electric bans now are complicated. Why ngithi complicated? Ugesi ne siyayithi it takes the path of least resistance. Ngisho ukuthini ngalokho? Uma ushaba ugesi ngeke uzubone esikhumbeni ukuthi ushile ngoba ugesi ugijima ngaphakathi. Uhamba twayini lezinto lezi, uhamba ngamamasela, uhamba ngemsipha. Lezo zinto lezi awuziboni ukuthi ishile. Wena uyitshela ukuthi hayi ungene nje wadlula. So imasela, you can imagine amamasela esinawo ukuthi mangakanani emzimbeni, and imasela elibaluleke ukudlula wonke inhliziyo. So mawusha ugesi ungayimisa nti inhliziyo yakho as much as ukwazi ukuthi uphinde uyistart. So inhliziyo futhi ugesi uyakwazi ukuthi uyimise. So ama-electric bans, they are very dangerous ngoba angakubulala abantu kodwa bengaboni ukuthi ushile ngenxa yokuthi agijima ugesi ugijima ngaphakathi. Umuntu nje uzobona kunechashaza yani, angithi mhlawumbe sikade ibambile intambo leyo. So unechashaza nje lincane la kungene khona ugesi. Umuntu athi akalimele lo muntu, kanti ugesi ungene la wahamba ngaphakathi wagijima ngamamasela wayophuma kwenye indawo. Uzobona nje unechashaza la, unechashaza onyaweni, kanti umuntu ushile ngaphakathi.
Okay. Sibonge kakhulu Dokotela. Sister Mirriam, njengoba Dokotela Pam esechazile ukusha ngama-minor nama-moderate nama-severe. Siyazi ukuthi mawushile ekhaya kuyi-minor, abantu banokufaka ama-Colgate, bafaka ama-Cyanide. Singakutreat kanjani ama-minor bans at home, Sister Mirriam?
Okay ke balaleli emakhaya lenganixwayisa ngako ukutreat ama-bans emakhaya. Kuthi lesikhathi lokubona ngaso ukuthi umntwana ulimele noma umuntu omdala ushile. Bekumele ukwazi ukuthi siphuthumise kakhulu masinyane emantini labanzayo. La uyokhula khona lo mlilo ngoba lo mlilo la ushe khona kuyashisa vele uva ngathi lo mlilo solo uhleli. Uzameke ku-avoid lokufaka ama-sunlight tonke letinto leti ngobe na ufaka leti naloku kubhasta lama-blister kuwaqhamisa lawo mandi lafoma kulama-blister lawo nekhathi uwapushuta lawo mandi lawo-ke u-expose lesikhumba sakho lesilange phakathi kuma-infection selesilonza sakho noma besawumane sisheshe siphole mara because wena sosivulile sowuvulele ukuthi emagqiwane ahlale lapho lawo magciwane lawo kade end up uba ne-infection leti abayisevere leti awudinga ukuthi ube nesikhathi leside uba ku-treatment yokutreat-a lawo mawundi lawo. Kanti nangabe uthi uyabona ukuthi leyo phathi yemtimba ishile iphuthumise emandini, uyibeke emandini lapho nangabe unema-ice faka ama-ice kulawo mandi lawo. Kana unema-ice pack ufake i-ice pack. Kungako e-clinic nanginika ama-health education ngithi ngiyabathi emakhaya njengoba ngise-village akusilula ukuthi bathole ema-bench shelves because ayakhosta mara i-ice pack ungaba nayo efridge likhaya nelikhaya most inyalo sebanawo ema-ice. Apply leyo ice pack leyo. Now ne-bench shield then you just apply leyo bench shield just to cool down le area letabe ishile ukuthi lo mlilo ungawuva ukufunisa tinto letiningi. Nangabe ukhona kune-paracetamol ekuthiwa yi-Panado. That's the simple muthi lo ngawunatha ekhaya masinyane just kwehlisa lobo buhlungu. Now ubona ukuthi lo buhlungu lobo bu-unbearable abubheketeleki. Uma kune-clinic ledvutane nawe phuthumela e-clinic uyokukhona kuthola lisido. Kuba wena unga-add ama-Colgate, u-add amaqanza, u-add tonke tinto leti tawudamage leso sikhumba sakho njengoba udokotela sashilo ukuthi kunama-degrees alobusha kuyadependa ukuthi ushe kanganani. Wena uve ulomunye athi ushithola ukuthi bekamane washe kancane wathi u-apply sunlight kwanyamalala. Wena ushele sikhumba sakho siphumile lapho ulandzela leyo sunlight leyo uyafaka. Sunlight remember insipho. Nyalo exposure le area layo loloshe kuyo kuma gciwane la magcile lesilonzela is area sokubheka seliphakathi kwende silonzela esikhulu kanti kube ngawena vele waphuthumela emtholampilo ulodvutane noma clinic la utokhona kuthola lisito khona balalele emakhaya lento nixwayisa ngakuthi singalaleli ukuthi loya wathithe kanjani thola lisito lokungilona lona ukuthi utokhona ukuthi usiteke ngendlela lekungiyona yona.
Sibonge lapho Sister Mirriam. Mrs. T, ngikuzwe uthi wathi mawuceda ukuthola ukuthi usasha wase uzithela ngamanzi and then why nini esibhedlela?
Esibhedlela ngayiswa the very same few hours.
Okay.
Ekutheni sisave umntwana lo bekasesengaphakathi and then umlilo usumkhulu. So i-ambulance ibikhona laphayana, firefighters they were there trying to rescue umntwana kuleyo room egcwele smoke and flames and everything.
Dr Mathebula, uma umuntu sekafikile esibhedlela with amabhensi ngokuhlukahlukana kwabo, ngabe nina nibodokotela niwathitha kanjani?
Okay, uma umuntu efika esibhedlela into yokuqala ke sifuneka siyenze ukuthi senze sure ukuthi whatever imshisile ayisekho angithi. So mayishiso amanzi asukile, uma ishiso umlilo stophiwe simkhumule nalezo impahla lezo ayigqokile ngesikhathi eshe ngoba zisuke sisabambe ukushisa so sizoqhubeka nokushisa ngoba njengoba ke washo I think beku sister not uMr usister Mirriam.
Sister Mirriam, okay, yes.
Ukuthi kufanele ufake amanzi abandayo khona uzopholisa la ushe khona. So cooling off is important. Kodwa as much as the cooling off is important, kuyafuneka ukukhumbule ezwela ukuthi uluza ukushisa emzimbeni ngoba njengoba ushile isikhumba sesiba exposed. So ke kuphuma amanzi, kuphume nokushisa. So ushile yebo kodwa kufanele ufudumale at the same time. Asifuni ukuthi ubande ugcine sewuba nento ekuthiwa i-hypothermia. Okunye ubaluleke kudlula konke i-pain control. So kufanele umuntu athole into ezodambisa inhlungu uma umuntu eshile. Amabhenzi ke kuya ngokuthi ke usheka kangakanani. The deeper the pain, the less painful. Ngiyazi ukuthi akuyenzi sense lokho mangikusho. Indaba ngisho kanje. Uma isase superficial, ushe isikhumba nje la ngaphezulu kuphela. It's most sensitive, so kubhlungu. Second degree burn, nawo ushilo usashe ngaphezulu ukuthi ukungena nje kancane kodwa kwangadlula efutheni. So ama pain receptors or ama nerve endings asase intact. So nako lokho kubhlungu. Mase siqala zithi third degree ipain yakhona iya ngokuya yehla ngoba manje sewuya deeper into ama layers okusho ukuthi nama nerve endings ayasha. U-third lo fourth degree burn, actually u-fourth degree burn i-patient isuke ingasena pain. Yindaba ingena pain ngoba ama nerve endings ashile themselves. Hayi kodwa ngoba kuukuthi ipain ayizwa ipain okwangempela. Ayizwe pain ngoba ama nerves ashile kodwa kona uzoba nayo ipain which is just phantom or referred pain at later stage. Kodwa wonke umuntu oshile regardless of i-degree kuyafuna ukuthi umnike something ye-pain ngoba kubuhlungu. Bese-ke most importantly fluid management is very important uma umuntu eshile ngoba uma ushile njengoba ngishilo isikhumba siyasuka kuphuma amanzi kuphume nokushisa esikhumbeni, and uma uluza amanzi emzimbeni siba dehydrated, and uma uba dehydrated then you know izinto ezizolandela, so uzodinga amanzi amaningi. Uma ungena wathula lawo amanzi izinto zakho gcina sezilimeni bese ugcina umuntu esedinga dialysis at some point, mhlawumbe agcine esedinga ngisho izinto ezifana no kidney transplant, and siyazi lezo zinto ukuthi eSouth Africa asitholi kalula. So ingakho kuyafuna ukuthi umuntu uma eshile enze sure ukuthi amanzi, fluid, it's very important whether uyamphuzisa or umfaka ngedrip. Kodwa-ke uma usesibhedlela akubi lula ukuthi sithi phuza ngomlomo amanzi ngoba ngithi-ke ngoba kufuneka sikise theatre manje kufuneka ustave beforehand, so it's much easier-ke ukuthi sikufake ngama-drip amanzi, and amanzi sikunika wona after ushile it's a lot, so angeke akusiyona into ongakwazi ukuthi uvele nje uyithathe ngomlomo, so ingakho isihlala sikunike ngama-drip. The higher the percentage, the higher the amount yamanzi ozoyidinga. So uma for instance uthole u-10% wama-bends, amount ama-fluids ozoyithola ayifani nomuntu oshe u-25% wama-bends. So yilokhu engakusho nge-treatment. Bese-ke njengoba ngisho-ke ezinye izinto-ke ezizayo-ke ama-dressings lapho Sister Mirriam khona bebakhona involved, bese-ke kuba khona nezinto esibiza ngama-debridement or ama-scapectomies la sisuke sesisusa khona-ke isikhumba lesi esishile ngoba isikhumba masesishile sifile asizukusebenzela, and uma sesishile bese siba yi-source of infection okuyiyona leyo sisuke sizama ukuyi-prevent, ingakho siyakufuna ukuthi siyisuse.
Sidlulele phambili ku Dr Nombulelo. Ngiyazi namanje senza lokho vele naseyibhedlela ukuthi before bawufika kuma plastic surgery ama patient ahlala nathi isikhathi, kanti maybe khona lokho ku wrong esikwenzayo. Kufanele abantu abashile baye nini kini as a plastic surgeon?
Like Dr Mathebula eshilo ukuthi kuma-bends kubalekile ukuthi uqala kanjani management yakho and uyiqala nini. So kubalekile ukuthi you do things right from ekuqaleni. Uyabo, so ukuthi which bends ezithunyelwa ukuthi kuma-plastic surgeons and then which patients, it really depends ukuthi i-patient ishe kuphi, ishe kangakanani na. I-plastic surgery we divide it into ama-forms awu-2. We say ukuthi yi-form and function. So mase sikhuluma nge-function manje ukuthi for instance usually mawukhuluma nathi ama-plastic surgeons sathi hayi sifuna ukulinda ukuthi ama-scars amachore and then we can do a reconstruction. But in areas now where a function your patient is compromised, lapho manje siya khona even if it's earlier. For instance, if umuntu ushebusweni and manje unento sithi ectropion or amehlo akavaleki kahle, if lokho kwenzeka they can get the drying of the cornea and then izo affecta ukuthi babone kahle. So in those instances we reconstruct early. Sibathathe, then we make sure ukuthi sibasa theater, si release ama contractures early to preserve the function. So we intervene early, we in the intermediate phase and even in the late phase. When do we intervene early? Ulama patients, for instance, if bashe izandla, we don't want to wait up until they develop ama contractures, they can't use iminwe yabo, or by the time they come, we can't really help them in terms of this joint stiffness. So we intervene early lapho. In terms of the face as well, we sifuna ukuthi lama patients lawo are referred early ukuthi, so that we can assess ukuthi yini esingayi preserve. Even net debridement yabo, we tend to be more conservative because sifuna ukunikeza a chance after resuscitation ukuthi do we need, how much can we preserve of the special tissues so that si prevent would deform patients with just a debridement. And then then also in the genital areas as well. So even nalapho, we want to intervene early so that sibone ukuthi, because sometimes when our colleagues, they go in before Tina, they become aggressive kuma debridement. So sifuna assessa sibone ukuthi, okay, this one sifuna intervene manje, or is it something that can wait in the intermediate phase? When is the intermediate phase? It's when manje ama-burns might say izilonda zivalekile, whether it's via the skin graft or zona ngokwazo they got re-epithelialization. So, but now that is the area that is between 3 weeks and 12 months. That is the intermediate phase. When do we intervene? Kulapho maybe on the ezandleni kuma joints, because abanye angithi because of pain, maybe they didn't get occupational therapy, or they didn't use ama-splints ebebawinikiwe, so bazama ukuzigokosa so that they don't feel pain. So they end up now developing ama-contractures, whether it's on the elbow, whether it's axilla or esandleni. So those ones we need to intervene early as well to preserve function yele joint zabo. So then we do contracture release, and then some procedures, whether nama flaps or skin graft, depending ukuthi how much of the local tissues are still available at our disposal. And then once now the function is preserved, that is now after 12 months, now those ones are chronic scars. That's when now we decide that they can either heal their own normal scars, or by what we call hypertrophic scars, or others, they develop keloids, depending on how the burns were managed before and the depth of the burns. So even now we classify them, which, okay, this one is just a normal scar, it's not hypertrophied, there's no flexion contracture. So maybe we just need to flatten it a bit. We can treat it with dressings like silicone dressings. We can treat it even with the injections like steroids, like injection, just to make sure that the tissues are soft and pliable before we can even reconstruct. Then especially those who were not done skin graft, then bazo develop keloids now. Then we need to intervene even then, that we need to excise keloids, and then we need to do either skin graft after the keloids, or we do serial excisions keloids up until the whole tumor keloid is completely cleared. Then now we can address the cosmetic side. So like I said, that is the function first, then the form. Yes. So once we've addressed the functions, we form okay, how can we improve? Because but because of the contractures, maybe the commissure is the mouth is leaking, and then so we need to go in and restore the function or the oral competency. So, and then now in terms of their appearance now, that's when now we can start coming in. Okay, do we need to do fat graft, Lana? Do we need to augment the shape of the eyes and all of those things, depending on what complications? So just to answer your questions, we are involved in all the stages, whether it's acute management, intermediate, and also chronic stage.
Sibonge kakhulu Dr Nombulelo. You know, uchaze kahle lento ukuthi fanele nibizwe early ukuze intervene early. And enye into phela thina ama plastic surgeons sazi nje ukuthi nina change impumulo, you change imilomo, but namhlanje sifunde kakhulu ukuthi you play a major critical role kubantu abashile. Mrs T, akusichazela ukuthi uma usungena esibhedlela, which treatment did you get?
Doctor, ngiyabonga. I can't say exactly what happened because I was sleeping the entire time, like 6, 7, 8 months. When I woke up, most of my skin grafts were done. Everything was done. What I knew was I was on life support, and they were feeding me with a tube. That's the only thing I woke up to realizing. But step by step, I just learned. Maseng nizophola ngiphuma a year later, okay, they've done this, they've done that. I've had few reconstructive done, like my lower lip was being operated. Still now, Dr. you get my lips are 17 because mine were 4th degree, like they were bent completely. They tried to do whatever, but they're still leaking when you eat. You can't eat in public. You have to make sure that even when you eat, you put your food deep inside. And I lost my lobes as well. getting my, reconstructive is very, very expensive. And it's so sad because burn survivors, most of them, they can't afford it. And the most, in my group, I have more than 500 burn survivors who can afford only to fix constructions, because when you go to the hospital, they'll put in this long, long list that you wait and wait. You end up getting used to living with the conditions that you have and living with the constructions that you have, because you keep on going to the hospital. They put in a long list. So there's still a whole lot of improvements that need to be done medically when it comes to burn survivors. I'm a third degree, 80%, and people still think I burnt yesterday, and it's 12 years later, but I still look like I burnt yesterday because I'm a third degree. My face was deeply burnt, and it's still tight. Even today, you'll think I'm wearing Botox, and I'm not. But we're trying everything. We have a dermatologist that is helping us just to loosen up the skin and everything, luckily for free. But there are some things that angeka khona ukwalungisa. But we are thinking, hopefully we'll get there medically when it comes to burns.
Sibonge Mrs. T. Dr. Nombulelo, njengoba umbuka Mrs. T kulesimo akuso khona manje. Yes, bamsizile abodokotela lapha abangasiza khona. Ese plastic surgeon kukhona mhlambe okunye ebeningakwenza or eningakwenza kulesimo akuso khona manje. And ngiya understand nje it's because maybe njengoba ukuthi bathatha isikhathi isibhedlela kunama queue. Is it because of ama-plastic surgeon nibancane noma kwenziwa yini ukuthi kuthatha isikhathi ukuthi bathole usizo olufika kinini?
I think each challenge she's correct we've got a long waiting list. And then in the public sector, we tend to prioritize reconstruction over our cosmetics. Ne? But under that reconstruction, we've got a long list. We have our patients with cancers that we can't have a waiting list of cancers. So for them, they always take the priority. And would have or other benign tumors or other conditions like neurofibromatosis. So we've got all those different limbs that we need to save. So now we need to prioritize now what is life-threatening. Then that takes more of the priority. For instance, if we have 2 lists a week, then out of those 2, that there must always be a cancer patient. And then the other reconstructions, then we need to take maybe 1 or 2 we add there. So if you have got more than 200 patients on the waiting list, it is not unusual that the patients can wait even 3 years for reconstruction, especially if it's something that is not life-threatening, even though it causes functional impairment. So it is, one of them is because of the staffing and also theater time.
Oh, kuyavakala dokotela. Manje maseniqedile nina ukubatreata, akhona yini amanye ama-complications adevelopayo after senenzike i-plastic surgery or bathi nenze i-skin graft? Kuba khona yini amanye ama-complication angadevelopa? What are they supposed to do post-treatment kahle hle fanele basinakekele kanjani?
Okay, it really depends ukuthi i-patient how the severity of the burns, ama percentage ukuthi be affected how much emzimbeni, which areas were affected. And then once now we come to that, and then we need to stage ama procedures. Angeke senze yonke into all at once. So prioritize. For instance, if une contracture ye axilla, ne ye elbow, even the wrist, we're going to start with the most proximal one. So just to try to improve function. So we stage them. Ideally, we need to stage them between 3 to 6 months, but sometimes they even wait 2 years in between procedures. And then once we're done with that we come to the face as well. That, okay, what is important? Like I said, that with the eyes, feeding, the ears, so all those things, they take the priority just to improve the function. So it can take, it's a journey. It's not like mawufika now it's your turn ukuthi we take you to theater sizokwenza yonke into. No. Sizo prioritize ukuthi which function is affected the most. Because remember, every surgery it carries a risk. Kunaba nama complications. For instance, if we share both hands, we can't do both at the same time because you still want to eat, you still want to help yourself when you go to the bathroom and all of those things. So see our stage alama procedures up until we get to a point which, okay, this is the best possible results that we can offer you. And then we still follow these patients up. And then one of the most feared complications years after the burns is what we call Marjolin's ulcer, which is a squamous cell carcinoma because of the chronic inflammation in that area of burns, especially if a patient is being a skin graft. So we also educate them about this, even if it's 10 years later, ukula islonda, ubon ukuthi asipoli, come back so as when the biopsy check ukuthi kwenzakalani na, because we're not sure is it aggressive, the tumor itself, or because our patients, they present late because they are not informed, because most of them, by the time they present, lymph nodes, so there's regional metastasis, it tend to be more aggressive. So we try to empower them. So usually burns patients, we don't entirely discharge them from our care.
Okay. No, sibonge kakhulu dokotela. Mrs. T, ngicela ukufaka mhlambe ngingakuvisa ubuhlungu ngivuse inhlungu zakudala. Wathi uma uqala nje usophuma esibhedlela, mawuthatha isibuko uyibuka, how did you feel? And namhlanje uma ubuka from that time, uqala ukuzibona esibukweni na namhlanje the way ufila kanjani sis?
Truly speaking, ekhaya they made sure that I don't get to the mirror. I had to sneak with a nurse that, when I see my nose and lie about it because I was curious. And the fact that Besegukdalang understand the condition, I just wanted to see my face because I could see I was pinkish everywhere. And looking at my face, I was like, wow, anyway, not bad. That's fine. At least I'm still alive. Because it took time to digest this whole thing and digest the passing of my daughter during that period where I couldn't even attend. So there was a whole lot of things that I digested while I couldn't do anything on myself. You know, you're on catheter, everything, you just become this cabbage. And once you see yourself in the mirror and you can sit up, all I had was gratitude that I'm alive and all I need is to get out of this bed so I can be out there and enjoy life, because I understood that my face is damaged and it's somehow deformed, but the fact that I fought it and the pain was massive, it's not something that I'll go outside and be sad about it because it's all over. So I was so happy going out where even if being too sabantu, but they couldn't understand the journey that I've traveled through the healing to get to where the pigmentation is not back yet. But the fact that now I went to rehab so that can help me walk again. So me putting my steps out there, walking in public, it didn't even affect me because I just understood that they just need to be taught about burns. That it's not something that is taboo. It's just that people, when they are burnt, they go on hiding and think it's not normal way to live life. So I refused to be sad, and I felt that I owe it to my daughter to come out and be like, we burned, but I'm still here. Can we live life and choose happiness over it, regardless of how I look? And it started from there, and I never looked back.
Sibonge Mrs. T. Your journey is painful, but it's giving hope komunye ohlele ekhaya namhlanje obeyivalele endlini naye asaba ukuphumela abantwini, kanti futhi iyasifundisa nathi siyabantu ukuthi masihambe emall siyekele ukubheka sibe na that look kini, but sinamukele njengathi wonke umuntu. Ngibonge kakhulu Mrs. T. Sister Mirriam, abantu masebe badischargeile kuba nama-wound, ngeke ngizwe nje masibhala ama-discharge lapha esibhedlela ukuthi go for wound dressing. Omunye afika ekhaya athi Sister just utshintsha amabhandishi kuphela ngingashintsha mina ekhaya. Ungachaza ngokuthi kubaluleke ngani lama wound dressing ukuthi bawenze kubo sister futhi nokuthi bayenze follow up yawo.
Okay ke balaleli lengathanza kunixwayisa ngako ngokubaleka kakhulu kwebona ama wound dressing eclinic kubo sister. Because now like it utona wound dressing let's khona assessa khona le wound. Is the wound progressing or the wound is deteriorating? Last bona ukuthi kunemphumela iyaphumelela phambili or sibuyele emuva la kulesilonga. Ngoba engasikhathi uthi wena sister ne-20 bandage le expected time lekumele sibone ngayo ukuthi lasilonza siyaphola. Wena uyathi delay solule ekhaya usebenzisa ama product la wrong uyathi infect lapha because the infection it starts when you are treating the wound, sterility, because when you treat the wound, angeke umanage uyitreat ngathi utreat something like a normal thing. You need to make sure ukuthi sterility sakho si good, and then usebenzisa ama product la right, we observe your wound, the wound yakho iya progress iya healer, kune granulation. Let's say for an example, you need to see the product usebenzisa yona iya it's suiting the wound, then you can change. If let's say for example, maybe abo gelonet for an example, then you're gonna know man. They want to learn I progress with this product because it's an advanced wound personnel, then you will able to understand, then you switch to the correct one so that the slons are less on treat us on skona ukuthi siphole lo muntu abuyele back em17 or abuyele back ekhaya sa right. Lokubaleka kakhulu balalele emakhaya ukuthi slons alalelani nangabe kumele uyosi treat e-clinic, follow it up, ungatithathele ama chances because you will make lots of mistake, and those mistakes they're going to cost you. The wound will take long for healing, and it will cause an infection, and then you end up with septicemia. Septicemia is the last stage. You know, so if you are to a wound care, la lesions are cause the infection, then say supply into your bloodstream, ganzi. Because loans are less manage but because when I was on lalela discharge your spell that I was mbabonile sister bevavela people publish bawashing emuthi lo njani ngemandila njani babese bayambona kanti it's not all about ukuwasha siya observe siya check ukuthi leso silonza leso, because for an example ushile kulama different types of ama burns ushile and ushile deep down nyale sibedlela babona ukuthi no for example lo muntu angamuka yo treat lesilonza ekhaya bakutshela ukuthi okay for ama burns kufuna uye e-clinic yobandisha maybe every second day or every third day. Kulesizathu bendela ukuthi ukhona ukuthi sibone sikhona kubona ukuthi siya improve in lesilonza or as improve wena uyahlala ekhaya i-set discharge silonza bandage le sticker into the wound lase skipper sesiphula nalama granulation later khona lesilonza siset get destroyed because wena uhlele isikhathi ungaletha e-clinic utotshela ama bandage.
Sibonge kakhulu lapho Sister Mirriam. Dr Nombulelo, sesesivala nje, ungamxwayisa uthini umbukeli onama burns ekhaya?
Okay, engifuna ukusho nje kumbukeli uma unama burns, whether it's acute burns or ubunawo, then what is charged, ungahlali ekhaya, seek the help. Like ushilo Dr Mathebula ukuthi it's important how we start managing so that we can prevent our complications. So it's important ukuthi, and then masesini discharge ile noba ubona ukuthi wound yakho ipholile so kuhlala if une follow up keep on coming, because sometimes siqala kahle and then masesiba discharge umuntu angacomply asebenzisa ama splints wakhe manje uzobuya sekulate senama contractures and all of that. So it's very important ukuthi ama patients they must comply ne treatment esibanikeza yona. We try to treat them in terms of multidisciplinary ukuthi sinama physiotherapists kuma team wethu, sinama occupational therapists, we've got our plastic surgeons, dietitians, all of that it is to help you. So masinikeza this management plan, this is a journey, we can work it with you. So now nama psychologists, because we understand what is sometimes it can be a bit overwhelming, which manje this is gonna you must adjust now to this lifestyle if in your family. So there is those the measures that we've put in place ukuze sikhona ukuthi sinisize. So ngiyacela ukuthi abalaleli ekhaya ukuthi ba comply nge-treatment plan esibanikezela yona so that we can get the best possible outcome for bona.
Sibonge kakhulu. Mrs T, ungathini kumbukeli osekhaya sesigoqa nje umbukeli osabayo uphumela ngaphandle because of ama-bands akhe asebusweni kanti futhi nje leliviki leli khona intombazanyana ebulewe kabuhlungu nge-gender based violence ungaxwayisa isizwe uthini ngalokhu okwehlele wena ukuthi mhlambe sizame ukuthi sukustope lokhu.
Mina engizothanda ukukusho based on domestic violence and ama-scars and how we look. One thing is impilo iyaqhubeka. You don't have to look like the model esiwabonayo. Indlela yakho ekhethiwe uNkulunkulu ukuthi uyihambe and ukutrustile ukuthi uzoba strong ukuyihamba. So the more you hiding yourself, you hiding your healing. So impilo kwamele iqhubeke. Mangabe umfana uyindoda usesi and uzithola ushile futhi thola uncedo masinyane ukuthi uzokhona ukuthi the more nakhona the wound stays is the more ukuthi izokhosa iscar. So the more easier you get help is the easier uzokhona ukuphola. And for those who are suffering scars ama-keloids nani akhona ama pressure garments. Even if we can't afford to go to the doctors and fix ourselves, believe me, ama-pressure garments ayasebenza kakhulu. Uyakhona ukuwathola once off last almost 2 years. When you're wearing them, you end up your scars are flat and soft and healing. So don't just sit there, go out, seek help. I've walked this journey for a very long time that I could call myself a scar doctor now.
Sibonge kakhulu Mrs T, sibonge kakhulu. Sis Mirriam, I believe prevention is better than cure. Akusithathe nje usibeke sisi ukuthi singawa preventa kanjani ama-bands.
Okay, balaleli lengani xwayisa ngabo ku prevent ama-bands. Ithi kuba careful kakhulu kubalekile. Esikakhulukazi kunalenye lesingakayimentionanga ama-bands afana ngike ngaba nalenye i-patient le yayishe ku-overheating yemoto. Ibone into uthi iphuma emotini and then wagijima masinyane wavula ibonnet and nekavula ibonnet then aphuma amanti. I don't know how it go. Bamphuthumisa bamtisa clinic only to find out because I'm the only sister at clinic. I just resuscitated him masinyane. I kept him warm and then one of the drivers emgwaqweni with taxi and then I can't drive the patient and then because the ambulance it takes time as in say village kubamphuthumisa esibhedlela. So lenganixwayisa ngabo ukuthi into lethi njengale la ubona khona ukuthi kunebungoti, please try and stay away from it. And then lokunye nalama steaming, the steaming nyalo ukuthi you're trying to prevent yourself from getting ama-COVID. Ngike ngaba one of the old lady legathi uyastima and then ubeke le usangena ngengubo uthi ufuna kuthela ebhavini then lenyawo lakhe laka right na tripper that container le ayithwelela amanti lashisayo, the whole leg got burned. So these are the things that kumele nithi iqaphele kakhulu balaleli ukuthi nabantwana ningabathumi ukuthi bahandlishe amanti lashisako nyalo kuyaba ibusika manje. When you go to bath umntwana, make sure you run cold water first ku basin before you can run the hot water because that can cause a serious burn. Umntwana uyobona ukuthi umthelele amanti ogeza afika jumpe ashe. And then again namatiya ningawabeki duzane nasematafuleni la umntwana donsa khona limwele ashe tiya lishisako mpholisele umntwana because utofuna ngasathi ujakile uye esikoleni and then ikakhulu emakhaya la kubaswa khona imililo then bantwana bangasonzela duzane nemlilo just for safety yabo. And then my hot water bottle, especially the diabetic please don't keep the hot water bottle on your lower legs because you lose your sensation very easily. Uto end up uba nama pressure ulcers and then nama bends. You can end up having your limb amputated. Lokunye futhi ama-plugs, you must have a safety emakhaya abantwana labancane those they are crawling bayafaka amathi ingalo tabo tiyafika ama-plug but then bathola ama-crunch lapho-ke. And nalabantu bezinyokanyoka emakhaya, please try stay away from kumesapha nama-electric wires. If you are not qualified to do any electric thing ungazami kuhlanganisa tinzambo, that can cause a serious burn. And lokunye futhi lengaxwayisa kakhulu it's ama timbawula. tingalali la khona because it dries out even your oxygen, and then nama heater in my bathroom, please try to avoid ama heater in my bathroom. Now wathi kuthi noma kuyabanza, make sure ukuthi i-heater manje uyibeke ku bedroom, uyongena masinyane kushawa ebhavini ugeze masinyane ubuye ngala, because nyalo lamanda yashisa lapha ne-heater ilapha, you drying out your oxygen, uyophefumula in manje, you will cause illnesses and then many things lekungendakala balaleli emakhaya. Ngiko lenganiqwayisa ngakho.
Kanti uma sesigoqa nje dokotela ungaxwayisa uthini kubabukeli ababukeli emakhaya ngama-beds?
Ama-bends izinto ezincane ezikhoza ama-bends. Yindaba ngithi izinto ezincane, uplug iketela uthi wenza amanzi, ubeka amanzi eti, uphenduke ubheke eceleni, iqhamuke ingane idonsa iketela. So izinto ezincane njengalezo kufanele uziqaphele. Uma kuwukuthi ubeka amanzi ashisayo, hlala lapho up until abile amanzi, uwasuse wena uwayise endaweni ephephile. Ungathi ngiyacisha ngizobuya ngibuye, ngoba wazi ukuthi ubani olandela emva kwakho. Iketela ungalishili namanzi ashisayo. Iketela masuqedile ukusebenzisa lokho kade ukusebenzisa, wenza inkomishi yakho yetiye, wachithe amanzi, ulisuse iketela lapho eduze nomntwana, ulicishe neketela odongeni, ngoba awazi ukuthi umntwana uzofika yenzeni. Ngoba uzothi uchitha amanzi ushiye iketela kodwa ulicishe lodongeni, afike umntwana ngoba uyazi ukuthi wena uyafika ukhanyisa, afika akhanyise la kanti iketela li-empty. The next thing uyaqhuma, uma qhuma kwenzakalani? Kuyasha endlini, sekuba nomunye umlilo lapho. So izinto ezincane njengalezo kuyafuneka siyinake. Istove sicishe odongeni, ungacishi kuphela la ubona khona, ngoba umntwana uzofika adlale. Kwesinye isikhathi umntwana uthola abantwana bayayidlalela bodwa, angene avinini omunye angithi badlala umacashelane, ucashile lokho avini, afike omunye uzovula akhanyise kanti kunomntwana estofini. Yabo izinto ezincane. Iy'ntambo zikagesi, kungabi ney'ntambo ey'hleli nje isinome kanjani, ngoba kuzoshaya ugesi, ngoba nje ngithi futhi ugesi ubucayi ngale ndlela yokuthi awuboni ukuthi umuntu ulimele kangakanani ngoba ugijima ngamamasela. So izinto ey'fana nje ezinye okuyishile kuSister Mirriam ukuthi nje ungalali nembawula, ungalali ne-heater ikhanya, ikhandlela bakwethu, ikhandlela, ngoba akusiwona wonke umuntu onogesi, akusiwona wonke umuntu onegesi, kodwa nje ikhandlela, gadi ikhandlela, licishe ikhandlela noma lihlala endaweni la ukuthi lingabambi ikhethini, umlilo ugijima ekhethini. Abasebenzisa amagesi nazo lezo zinto lezo wenza sure ukuthi i-room is well ventilated, ngoba igesi nayo inga-explode because umlilo lana endlini. Bese nalabo abasebenzisa i-primer stove nayo ugadi, ngoba lezo nazo ziyaqhuma zikhoze ama-burns.
Sibonge kakhulu Dr Mathebula, sibonge nolwazi oluphile kubabukeli emakhaya. Sithembe konke lokho sibafundise khona bazokwenza bakulandele. Sibonge kakhulu Sister Mirriam Zahoor, ngibonge kakhulu Dr Nombulelo Metuse, nakuwe Dr Pam Mathebula, nakuwe Mrs T. Ngibonga ngaqedi ngalolu sifundo enisifundise ababukeli emakhaya. Ngibonga kakhulu isikhathi senu. Kanti ke njengoba uDr Nombulelo eshilo ukuthi kuba nama-occupational therapist, ama-physiotherapist aba-involved, sisazoqhubeka kahle nesifundo sethu sama-bands. Sesibiza bona-ke ama-physiotherapist asitshele ukuthi bona nama-occupational therapist bayitreat kanjani ama-bands. Nisale kahle emakhaya.